Cureton
and Sarah Hirschberg
with the 6 o'clock news.
Tonight's segment we will be discussing a genetic disorder called Klinefelter Syndrome, also known as trisomy XXY.
This genetic disorder affects males in their physical and process of developing. Klinefelter syndrome affects 1 in 500 newborn males.
Many boys with Klinefelter syndrome struggle through their early teen life because of their body image. Men with Klinefelter syndrome have a regular lifespan.
Symptoms can vary by age.
That means that males with Klinefelter syndrome may have different symptoms at different times in their life. Usually, when a male has Klinefelter syndrome, he is about 5 years old. Compared to the other boys, they may be taller than average, have more weight in their belly area, clumsier than average, and the male will be slower when developing speech skills, speed, and muscle strength.
During the times of puberty, males with Klinefelter syndrome may have the symptoms of having smaller testicles and penis, larger breasts, less facial hair, wide hips, low energy, weaker bones, and may have less sperm production. When the men with Klinefelter syndrome are adults, they may experience not being able to have babies, otherwise known as infertility.
This disease is most commonly diagnosed when a man goes to the doctor because of infertility. Then he will get tested by using karyotyping and semen count.
Taking blood tests and urine samples can show uncommon hormone levels that are a sign of Klinefelter syndrome. There is no diagnosis, but if you catch it early, around the time of puberty, you can have testosterone injections to help you develop normally without many physical characteristics of the syndrome.
Now over to Dr. Rogers with more information on treatments for Klinefelter syndrome as well as the effects it has on the body.
Good evening, I'm Dr. Rogers. Klinefelter syndrome affects the brain by delaying speech, quiet personality, shyness, difficulty expressing feelings or socializing, and problems with reading, writing, spelling, or math. They may also have attention problems. This is a result of the brain having abnormalities. For instance, the total cerebral volume and lobar volumes, except parlate white matter, are significantly smaller, whereas lateral ventricle volume is larger. Cortex is significantly thinner in the left inferior frontal, temporal, and superior regions. These abnormalities in the brain cause learning and attention problems. Speech therapy and education support can help boys who have language and learning problems. With me is Oliver, a male with Klinefelter syndrome. Oliver, can you please tell me what it's like to live with Klinefelter syndrome? Please tell us what kind of treatment a person with Klinefelter syndrome can use.
Well, they can be given testosterone injection for treatment. Testosterone is a hormone needed for sexual development. This can help the boy with Klinefelter syndrome have a more normal body development if the treatment is started around the age of puberty.
In what forms can testosterone be given?
Testosterone can be given through an injection through a skin patch or gel.
Are there any other problems that can be solved while having KS?
Speech therapy and education support can help a boy with language or learning problems.
Did you have any social problems?
Yes. Many people have gone through bullying when they have Klinefelter syndrome, including me. Being verbally abused, taunted, and physically abused were a regular occurrence throughout my schooling years. Every day I lived in fear but never had the courage to tell anyone. They bullied me because of my larger chest and hips.
Klinefelter syndrome is not inherited, but randomly occurs during meiosis, correct?
Yes, it's an error in cell division called disjunction that causes an egg or sperm cell to have one extra copy of the X chromosome. This would be a sex chromosome trisomy, where there's three sex chromosomes instead of 2.
So this pedigree shows that the disease wouldn't be recognized because it is lapsed during meiosis.
Dr. Rogers.
I hope this newscast has informed you about Klinefelter syndrome.
In conclusion, Klinefelter syndrome affects males all over the world.
It has negative effects, but that doesn't mean the males living with Klinefelter syndrome aren't just like me and you.
Once again, this is Bianca
And Sarah Hirschberg
for the 6 o'clock news.
Good evening, I'm Olivia.
And I'm Bianca.
I'm Sarah.
And I'm also Olivia.
And thank you for staying tuned to learn more about the mutation that creates Klinefelter syndrome.
As shown in the last newscast, the reporters said that you can't inherit Klinefelters. In this mutation, it is a mutation that randomly occurs during meiosis.
In this segment, we will be showing how the non-destruction of mutation happens during meiosis.
Meiosis 1 starts normally, then the 4 sets of chromosomes move to the middle of the cell.
The chromosomes are split up and move to opposite sides.
After that, there are 2 cells, both with a set of chromosomes.
Then the chromosomes move to the middle of the cell.
Suddenly, in one cell, there are 3 chromosomes taken to one side rather than 2.
At the end of this process, one cell has only one Y chromosome, which does not continue.
Another cell has 2 chromosomes. In this example, one chromosome has an X and a Y chromosome.
Same thing with the cell next to it, shown in the diagram. One cell is very different from the others, though.
That cell ends up being the cell that has the 2 X chromosomes and the 1 Y chromosome, which is expressed with the symptoms of Klinefelter's.
This concludes our segment. Once again, I'm Olivia.
I'm Sarah.
I'm Bianca.
And I'm Olivia.
And I hope you enjoy this segment about mutations in Klinefelters.
And penises. Larger than
I can't do this.
I'm gonna laugh.
Usually when a male has Klinefelter syndrome and is about, dang it, 5 years old, were you supposed to have?
Hello and good evening. I'm Olivia.
Oh, and I'm Bianca.
Stop. You could have
We
passed that
ruined
by.
They have the symptoms of small intestine. Penises larger than
Penis!
Guys,